The new year began with more coronavirus cases across the country than at any point of the pandemic. The emergence of the highly contagious new variant is causing the virus to surge through communities faster than ever. In states like Florida, COVID cases rose by 948% over the holidays, according to data from Johns Hopkins University. As millions of Americans return to work today, however, the emerging evidence suggested Omicron variant is milder than previous versions of the virus. According to a new study done by British health officials, people who contracted the new variant were half as likely to be hospitalized as those infected with Delta. Many animal research groups have also found Omicron does much less damage to the lungs than earlier strains. And unlike previous surges of the virus, it's children who are being sent to the hospital in record numbers. The CDC reported pediatric hospitalizations spiked by 66% at the end of December. While doctors have said it's too early to determine whether Omicron causes more severe illness in children, hospital leaders have attributed the wave to the lower vaccination numbers among children. Earlier today, the FDA approved Pfizer and BioNTech booster shots for children between 12 and 15. Some immunocompromised children ages 5 to 11 will also be able to receive a third dose. And the agency also narrowed the booster eligibility for everyone from 6 months down to 5. Joining me now to discuss, Dr. Corey Hébert, BNC Chief Medical Correspondent. So first of all, Dr. Hébert, cases are surging, but hospitalizations and deaths are not increasing at the same rate. Studies suggest that Omicron is milder than Delta and other strains. What do you make of what you're seeing in the field as it relates to this virus?
Okay, so we got to lay it out very, very clearly. What we're seeing is that we have an increased number of cases. So statistically, without a doubt, you are going to see more deaths and you're going to see more hospitalizations. Now, it doesn't really mean that the virus is that less lethal. And let's think about it like this. The data points that we were looking at in Europe, the data points we were looking at in South Africa, were people that were just a little bit more fit than the people in the United States. They were a little bit less sick than the people in the United States. So there's a little more to be seen until we can actually say that that's the case. But even if the Omicron variant was less lethal, it's still going to have more cases of death and more cases of intensive care unit because just of the pure numbers. This thing has just run rampant across the country so quickly. It's so contagious. So now you're seeing that we're going to have so many kids in school. They're going to be doing what kids do. That means they're going to be playing. They're going to be, running around and sniffling and sneezing, and that's just what's going to happen. So you're going to see more kids. But I would like to just, as a pure person that is a straight shooter and not a devil's advocate, but a straight shooter, some of the pediatric data points suggesting that the children are in the hospital a lot more and are kind of sicker, those tests are done on kids that happen to be in the hospital for other things. Meaning that every kid in the intensive care unit is going to get a COVID test, okay? And if that kid is positive, then that kid is listed as a COVID positive case in the ICU, but he may not be there for COVID.
Anyway, I want to move on to a question, something that Marco Rubio tweeted last week. He said, record numbers testing positive for a sore throat isn't a crisis, and that the real crisis is the irrational hysteria which has people with no symptoms waiting hours for a test or missing work for 10 days. What do you make of this idea? I mean, I understand, that the virus has been politicized to a large degree, but, if it is slightly milder, does it impact in any way your opinion about how many people should show up to get tested or how long we should be out for recuperation?
Well, I will tell you this. I rarely say things about politicians on Twitter, but I also said it was also an option that Marco Rubio was just uninformed, unintelligent, and not really a person that you should ever listen to. I said that. And so with that tweet, because that is a real horrible, horrible tweet. Now, what I do want you also to remember is that there was, regardless of how this is going to affect the general population, okay, I want you to think about how it's going to affect African Americans, because a study came out today, and this is something I really want to push, okay? We talked about this 2 years ago to say that you need to make sure that you lose weight going into COVID-19. I stressed it, just over and over and over, because we know we're trying to get back to high school fine. I want people to go and get that high school picture and see. I want you to be high school fine again, okay? Because that is what is going to get you through, because you need to be healthy. But the study came out to say 46% increased risk if you're overweight, 46% increased risk of COVID, 113% increase of hospitalization, 74% increase of ICU, and 48% increase in risk of death if you are overweight. So as we're sitting here with BNC talking to African American folks, people need to remember that their concept of what they're going to do for the New Year's resolution needs to be to lose weight, without a doubt. It has to happen, because if we don't, Black people are going to have more death, because we have more hypertension, more diabetes. So regardless of what Marco Rubio says about this being a cold, if white folks get a cold, Black folks get the flu, and we know that many, many times. So we're not talking to the general audience here tonight. We're talking about our people, and our people need to lose weight, get more sleep, decrease their stress, eat more vegetables, decrease their alcohol, drug use, and decrease processed foods. That's what we need to do, along with getting vaccinated, wash up, mask up, separate, and vaccinate. And that's what's going to get us through. You heard it here, and that's what we've been saying from the beginning.
Right. I want to ask you a question about testing. I came across this really interesting article in The Atlantic from Benjamin Mazer, and it was he basically says, we need to stop testing so much if you are not symptomatic. And he's not saying that that the virus isn't a problem. He's saying basically we understand the government failed us. There are just not enough tests. Even the programs that they are trying to get online are not going to get online in time, that they'll be weeks away, if not months away, that you'll have enough testing for everyone who needs it. But there are people right now who have symptoms who cannot find testing, or cannot stand in the line long enough to wait to get the testing, and that they need some way to get that testing, and that the rest of us who are not symptomatic and also in the lines are basically using the testing that they actually need. What do you make of this kind of argument?
Well, the testing can be overdone. I agree. At some point, the reason why we use testing is really not to see if you are actually asymptomatic and you're positive, that we're going to give you some new medicine or anything like that. Basically, we want to know if you are positive. We don't want you going somewhere to spread this to other people. That's what it's about. That's why we're testing people at Dillard University before they come back to campus. That's why we're testing people at colleges across the country. We testing people before they go into work, because we don't want people to go in and spread it. So it's not necessarily a health issue, it's more a public health issue. So while I do understand his point, there's really no way around trying to make sure that we try to limit the amount of exposure that people actually have to other people that have positive case of COVID-19. Because what's going to happen is you get COVID-19, whether you're symptomatic or not, you go back to your house, somebody's going to be somebody's going to have cancer, somebody's going to have a decreased immune system, and then they're going to get it and they're going to die. And that is the reality. And no matter what, we have over 800,000 people dead. And we can call it a cold, we can call it whatever we want, but we know that those people got sick from COVID-19 and they died. And that person, you can say it's rare all you want, but if that's you, that's 100% in your household. And we can't have that as African Americans. So we have to do the things that got us to the point to flatten this curve. And now this curve is so steep, it's a straight line up as opposed to being flat, which it was about 6